Good day. Most individuals experiencing frequent nighttime urination are unaware that their daily hydration habits may be contributing significantly to the problem. Consuming adequate water is essential for health, yet the timing and distribution of fluid intake can profoundly influence nocturnal urine production and sleep quality. I am Dr. Smith Amsterdam, a board-certified urologist with more than 24 years of clinical experience specializing in bladder function, nocturia, and age-related urinary disorders. I have treated thousands of patients who report disrupted sleep due to repeated nighttime voids, many of whom initially believed they suffered from a primary bladder pathology. In the majority of cases, targeted adjustments to fluid management strategies have yielded substantial improvements without pharmacological intervention. A prospective study conducted by researchers at Nagasaki University demonstrated that strategic modifications to fluid intake timing and volume can reduce nighttime urination episodes by approximately 40% in adults over the age of 65. Additional research supports the efficacy of these behavioral approaches. Before we proceed, I invite you to reflect. How many times do you typically awaken at night to urinate? Please share your experience in the comments section below, including your age group if you feel comfortable. Your insights help inform future discussions. In this presentation, I will outline the 3 most effective, evidence-based hydration strategies for managing nocturia. These are presented in ascending order of impact, culminating in the most transformative approach. I encourage you to listen carefully through to the conclusion. Establish an evening fluid cutoff. Let us begin with the foundational principle: strategic restriction of fluids in the evening. The kidneys exhibit circadian rhythmicity. During daytime hours, they maintain higher urine output. As evening approaches, the posterior pituitary increases secretion of arginine vasopressin, also known as antidiuretic hormone. This hormone acts on the renal collecting ducts to promote water reabsorption, thereby concentrating urine and reducing overall volume. When substantial fluid volumes are ingested within 2 to 3 hours of bedtime, this natural antidiuretic mechanism can be overwhelmed, resulting in increased nocturnal urine production. A structured evening fluid cutoff has been shown in clinical evaluations, including data referenced from University of Toronto research, to reduce average nighttime voids from approximately 2.8 to 1.6 episodes, representing a meaningful clinical improvement. Comparable outcomes have been observed in studies from Maastricht University and related cohorts. Clinical example. Consider the case of a 68-year-old patient who previously experienced 4 nighttime awakenings. Implementing a strict cutoff at 7:30 p.m. for a 10:30 p.m. bedtime resulted in a reduction to 1 void per night within 3 weeks, with corresponding enhancement in sleep continuity. Practical implementation. Determine your usual bedtime and subtract 2.5 to 3 hours. After this window, limit intake to small volumes, no more than 150 to 200 milliliters, and avoid caffeine, alcohol, or diuretic beverages entirely. This measure alone can produce noticeable benefits and synergizes effectively with subsequent strategies. Front-load daily hydration. The second key principle involves the temporal distribution of fluid intake rather than total daily volume. Many adults inadvertently dehydrate during morning and early afternoon hours, only to compensate with larger intakes later in the day. This pattern misaligns with peak renal efficiency, which occurs primarily between approximately 7 a.m. and 2 p.m. Consuming the majority of daily fluid requirements, typically 1.5 to 2.5 liters for most adults, adjusted for body weight, climate, and activity, during this early window optimizes daytime processing and minimizes nocturnal burden. Supporting evidence includes trials demonstrating that shifting approximately 70% of fluid intake before 2 p.m. can achieve reductions in nocturnal voids of up to 47% and decreases in nocturnal urine volume of around 35%, as observed in studies affiliated with institutions such as Keio University and related Japanese research groups. Clinical example. A 71-year-old patient previously reporting 3 to 4 voids nightly adopted morning-focused hydration combined with an early evening cutoff. Within weeks, nighttime episodes decreased to 1, accompanied by objective improvements in sleep metrics. Actionable protocol. Begin each day with 250 to 300 milliliters of water upon waking. Consume 2 additional substantial servings before noon. Gradually taper intake after lunch, transitioning to minimal sips by late afternoon. Combine consistently with the evening cutoff for optimal results. Sodium reduction and leg elevation for fluid redistribution. The most impactful intervention addresses fluid redistribution, particularly relevant for adults over 60. In many cases, nocturia stems not from bladder dysfunction per se, but from daytime fluid sequestration in the lower extremities due to gravitational effects and dietary sodium load. Upon recumbency, this pooled fluid re-enters systemic circulation, increasing renal filtration during nighttime hours. A well-documented prospective study from Nagasaki University Graduate School of Biomedical Sciences examined patients with high salt intake. Those who successfully reduced daily sodium from an average of 10.7 grams to 8 grams experienced a significant decline in nocturia episodes from 2.3 to 1.4 per night, alongside improvement in the nocturnal polyuria index. When combined with positional therapy such as leg elevation, reductions in nocturnal urine volume have reached up to 50% in responsive individuals. A 76-year-old patient with 4 to 5 nightly voids and elevated sodium consumption implemented dietary sodium restriction below 2,300 milligrams per day, ideally targeting 1,500 milligrams, together with afternoon leg elevation. Nocturnal episodes decreased to 1 or 2, with a documented 44% reduction in nighttime urine output. Comprehensive action plan. Monitor sodium intake for 1 week using food labels or applications, focusing on reductions in processed foods, breads, soups, and cured meats. Practice leg elevation for 30 to 45 minutes in the afternoon, positioning the legs above heart level using pillows or a recliner. Integrate this with front-loaded hydration and evening fluid restriction for synergistic effects. To summarize the 3 evidence-based strategies. Third, implement a structured fluid cutoff 2 to 3 hours before bedtime to respect circadian anti-diuretic mechanisms. Second, front-load the majority of daily hydration in the morning and early afternoon to align with renal physiology. First, reduce dietary sodium intake and incorporate afternoon leg elevation to minimize nocturnal fluid redistribution. When practiced together, these approaches often compound to deliver transformative improvements in sleep quality and daytime vitality. Your body possesses the inherent capacity to regulate fluid balance effectively when provided with appropriate guidance. Which of these strategies will you implement first? What has been your primary challenge with nighttime urination? I welcome your observations in the comments. If you found this information valuable, please like, subscribe, and share with others who may benefit. This presentation is intended for educational purposes only and does not constitute personalized medical advice. Nocturia may signal underlying conditions such as cardiovascular, endocrine, or prostatic disorders. Please consult your physician before making significant lifestyle changes, particularly if you have existing health conditions or take medications. Individual results may vary. Thank you for watching. Wishing you restful nights and improved well-being.